Calls are growing louder for Canada to quickly establish a suicide hotline similar to 911, but instead of being directed to police, people in crisis would be connected to mental health professionals. Now, this hotline has been in the works for a couple of years now, but some experts say it's not happening fast enough.
Canada has the third highest youth suicide rate in the industrialized world. Shocking. Shocking. And we don't talk about suicide prevention enough.
According to Youth Mental Health Canada, on average, more than 10 people die by suicide every day. And every year, almost 450 of those are between the ages of 10 and 24.
The reason we need national leadership and cohesion and ways of supporting people is that we have fragmented services across Canada in provinces and territories.
Over the weekend, 988 was launched in the U.S., a 3-digit number available to every American who needs mental health support. It's very similar to 911 dispatch, providing triage and then connecting people to the proper care. On our side of the border, there is a 1-800 number crisis line called Talk Suicide Canada that is open 24/7. But mental health expert Cheryl Boswell says we need to make access as simple as possible.
When people have health crises, they shouldn't be the detectives for their own health care. And that's what often happens, is that this is not common knowledge. You know, the 411, the 311, the 211, all of those were created for the very reason: access to information, access to support. We need to do the same with mental health.
The House of Commons unanimously voted in favor of creating this national lifeline back in 2020. And for more than a year now, it's been in the hands of the Canadian Radio, Television and Telecommunications Commission. Since then, the CRTC has been conducting public consultations and evaluating how the number could be introduced. Health Canada says it is expecting a decision later this year and is currently trying to estimate demand for this hotline.
I think the pandemic made it really clear that joblessness, homelessness, food insecurity, all of these kinds of issues impact your mental health and wellness. And now it's up to us. And it's up to us to follow the lead and really try to implement a service that can better meet the needs of people in Canada.
Now, Boswell says Ottawa still has to announce funding for this hotline, and she'd like to see training and hiring underway as soon as possible. Shauna Hunt, City News.